Hi everyone, my name's Kimberly. I'm going to be helping out today with the AP Psychology test. We're going to be going over the treatment of psychological disorders. So first, I just want to take a second to look at the outline, and these are key terms that we're going to be covering. Make sure to remember that this is 5 to 7%. So again, if you need to memorize this at all, go ahead and make flashcards. This is a good outline to get to pull out some key terms. And if you recognize it, great, because that means that you know some of these. Treatment approaches. So first we're looking at psychoanalysis approach, and the psychoanalysis was developed by Freud, Sigmund Freud, and it focuses on probing past defense mechanisms of repression and rationalization to understand the unconscious cause of a problem. Then we're going to be looking at free association, which is a primary tool for revealing the contents of the unconscious in which the patient reports any and all conscious thoughts and ideas. Manifest content is Freud's belief that the images and occurrences in dreams are actually representing the truly meaningful content of dreams. So then we have transference, which is the patient shift thoughts and feelings about certain people or events onto the therapist. And then we have counter-transference, where the therapist transfers his or her own feelings onto the patient. We're looking at the humanistic approach right now, and this approach treats the individual as a client. So there's client-centered therapy, and yeah. So this involves the assumption that clients can only be understood in the terms of their own reality. So this is different from Freud because this approach focuses on the client's present perception of reality rather than the past, which is something that Freud really emphasized. And this was come up by Carl Roger. So now we're looking at genuineness, and it's where the therapist is open, honest, and expressive of feelings with the client, where they're actively listening. And then we have unconditional positive regard, which is the acceptance and support of a person regardless of what the person says or does. Accurate empathetic understanding, which is the therapist's ability to view the world from eyes of the client. And then we have the Gestalt therapy, which combines both physical and mental therapies. So this was invented by Fritz Perls, and he developed this approach to blend awareness of unconscious tensions with the belief that one must become aware of oneself. So like this is a pyramid that you might see based on him. Yeah, so and how they deal with those tensions by taking personal responsibility. Now we're looking at behavioral therapy. Behavioral therapy is a short process. The methods focus on either just behaviors or in combination with thoughts and feelings that might be caused by them. Then we have counter conditioning, which is a technique in which response to a given stimulus is replaced by a different response. And aversion therapy, and its averse stimulus is repeatedly paired with the behavior that the client wishes to stop. Systematic desensitization is a technique involved in replacing one response, such as anxiety, with another response, such as relaxation. And then we have extinction procedures designed to weaken maladaptive responses, and then flooding, which is exposing a client to stimulus that causes the undesirable response. And again, we're looking still at behavior therapy. Implosion, it's a client imagines the disruptive stimuli rather than actually confronting them. And then we have operant conditioning, behavior control technique. We also have behavior contracting, which is where the therapist and the client draw up a contact to which they both agree and abide to. And then there's modeling, where therapeutic approach based on Bandura's social learning theory. We also have cognitive therapy, which is the one of the therapies included in this is the rational emotive behavior therapy, REBT. It's the idea that when confronted with situations, people recite statements to themselves that express maladaptive thoughts, and this was formed by Aaron Beck. Cognitive therapy is a focus on maladaptive schemes. And then we have negative trait, involved in a negative view of self, of the world, and of the future. This view is learned through experiences. And then we have the arbitrary inference, which is where the person draws conclusions without evidence. So they just kind of assume like, oh, you're standing next to the cookie jar, you must have taken like the cookie. Then dichotomous thinking, which involves all or none conceptions of a situation. For example, if I don't get this job, I'll be a complete failure. Then we have biological therapies. Biological therapies are electroconvulsive therapy, ECT. It's a form of treatment in which fairly high voltages of electricity are passed across the patient's head, as you can see in this image right here. You can also look some stuff up on Google if you'd like. And then we have psychosurgery, which is the biological treatment, and there's actually surgery, where it's a prefrontal lobotomy, which is parts of the frontal lobe are cut off from the rest of the brain, which is the frontal lobe right here, and psychopharmacology, which is a treatment of psychological and behavior maladaptations with drugs. So another biological therapy that we might look at is the psychoactive drugs, which is four classes. We have antipsychotics, antidepressants, antipsychotics, and lithium salts. Antipsychotics are symptoms of schizophrenia by blocking the neuroreceptors for dopamine. And then we have antidepressant drugs, which MAO inhibitors work by increasing the amount of serotonin and norepinephrine in the synaptic cleft. So again, I think the important part to pull out of this is what the drug kind of does, and keep in mind that these are biological therapies. Then we have tricyclics, and they are used more frequently. And then we have selective inhibitors, which work by increasing the amount of neurotransmitter at the synaptic cleft. Another one of our biological therapies is anxiolytics, depress the central nervous system and reduce anxiety while increasing feelings of well-being and reducing insomnia. Then we have some other ones which cause relaxation and feeling of tranquility. And we have lithium carbonate, which is effective in the treatment of bipolar disorder. So what are the modes of therapy? We have three right here. Family therapy. It's more than a single client, which allows family members to express their feelings to each other and to the therapist simultaneously. We have group therapy, where clients meet together with a therapist as an interactive group. And the 12-step programs, which is a form of group therapy usually not moderated by professional psychotherapists, so maybe like AA, which is Alcoholics Anonymous Strong Social Support System. So now we're just going to review quickly. I think the best thing you can possibly do for this is make flashcards and really try to think about, like, what does this look like, type of thing. So we're going to go over a mini review. The concept of accurate, empathetic understanding is most closely associated with which of the following therapeutic approaches? Psychoanalytic therapy, inductive therapy, client-centered therapy, implosion therapy, reductionist therapy. So go ahead and pause this video if you need to, if you need more time to think about this. The answer is C, client-centered therapy. So the cognitively oriented therapeutic approach known as rational emotive behavior therapy is most closely associated with which of the following? So go ahead and read through that list. And the answer is Albert Elias. Which of the following is not a major class of drugs used for psychotherapeutic effect? There you go, letter A. So again, if you have any questions or need any clarification, this is a very brief overview. So if you have any questions, please feel free to email us. And our email is located below. Also, remember to look at the links and please like and subscribe. And yeah, we're more than happy to help. So good luck with AP exams and make your flashcards. So good luck!